Welcome back to the Go Have Good Sex featuring the Christian Sexpert podcast. I'm your host, Angela, the Christian Sexpert. Today's podcast is actually an episode that aired quite a while ago on my Patreon community. My Patreon is where I teach the spicy things I can't usually teach on my regular socials. And it's a place for people like you to support the work that I do as I continue to bring you all kinds of free and useful education for Christian marriage. And one of the things that really deeply affects Christian marriages today is vaginismus. We know that women raised in purity culture are twice as likely to experience female sexual dysfunction, which includes vaginismus, as their non-purity culture counterparts. And there are a lot of women who experience vaginismus in the evangelical church today. I get a comment about this almost every day. If you don't know, vaginismus is, well, I'm going to let Dr. Leslie Wakefield explain that one to you. But one of the things that I want to say before we get into what vaginismus is and how we treat it is the people who are really angry about me talking about purity culture right now. Purity culture is not the same thing as biblical purity. Purity culture inflicted a lot of shame and trauma onto a lot of women. And if you are one of those women, I am so sorry. I am so deeply sorry that you have been affected by bad theology in this way. This was never God's plan for you, and you deserved so much better. So at this point, I'm going to turn it over to Dr. Leslie Wakefield, and I want to again thank her for being a guest first in my Patreon community and now as re-airing this for the podcast. If you want to connect with Dr. Leslie and talk to her about virtual treatment options for vaginismus, her contact information will be in the episode notes for this episode. As a side note, Dr. Leslie had me on her podcast back in the fall, and I will be dropping the link to that podcast in the show notes if you want to check out my guest appearance on her pod when you're done with this one. And remember, you deserve to have good sex. Hey guys, this is Angela, the Christian Sexpert, and if you can't tell, I have a friend with me today. This is Dr. Leslie Wakefield. She is a pelvic floor therapist with a practice in South Florida, and she is the host of Her Sex podcast. She recently had me on as a guest, and it was one of the most fun podcast recordings I have done in I don't know how long. And I am super excited because she's coming to talk to us today about vaginismus and how we can treat it. So thank you for being here.
Absolutely, my excitement and pleasure. The podcast recording was amazing. If people haven't listened to that, they really should, because you are a blast. I mean, they know that because they're here.
I will make sure that I link the podcast for everyone so you can go directly to the episode and listen to it because it was so much fun. So because I want to jump right into things, can you please explain to us what is vaginismus?
Yes. So vaginismus is a reflexive spasm of the pelvic floor muscles, specifically around the vagina, that makes penetration difficult or in many cases absolutely impossible, and at the very least extremely painful. And that doesn't have to just be around penetrative sex, which is really what we think about. That could also be tampon use. That could also be medical exams. And I have heard it described, which I really like. I can't claim it. I heard it somewhere else, but like a panic attack of the vagina. It's an absolute panic attack of the vagina. It's completely outside of the woman's control.
I like that. That's better than what I say, because normally when people ask me to describe it, I'm like, the cave of wonders shuts its doors and says, thou shalt not enter.
The teeth come in.
Yeah, that's like trying to explain, and especially because it's not my specialty. So like trying to explain on a basic level but I really like that. I'm going to start using panic attack of the vagina.
I liked it too.
I think as you were talking, I thought it was interesting that it occurred to me, you're right. It's not just about penetration. And it's interesting how even this female sexual dysfunction is generally linked to her ability to engage in performative sex acts for the male pleasure.
Yeah,
Like it's still all about the man can't penetrate. And it's not. It's about so much more than that. But
absolutely.
that's like the first thing that people are going to associate it with is, oh, her poor husband.
I'll tell you the truth. It's one of my most favorite things to treat. I find it incredibly rewarding. And so we see a fair amount of that in our practice. And it's really interesting to me that the majority of patients who do find their way to seek care, many of them are actually in a very supportive, very loving relationship. They may have sexual activity that doesn't involve penetration, and they may be perfectly happy with that. A lot of people are coming because I need to have a medical exam. I can't go to the gynecologist. I want to get pregnant, and we already know we're going to do IVF, but I can't tolerate the probe being inserted for ultrasounds. So it certainly does relate specifically to penetration, and in most women, it does relate to sexual penetration, but not always, and there's so many varieties. Some women may be able to tolerate touch to the vagina, to the vulva, let's say the area around the vagina. They may experience orgasm. They may have very particular ways that they can enjoy their sex life with their partner. Other women might not want touch at all. There's something that I call the ick factor. And so it's like the whole area is like, if it could push you away, it would. It's not just a physical spasm, but it's also this like full body emotional response of like, get the heck away from me. And it's a little bit different for every woman, but I would say for the most part, most women I treat have that sort of emotional component to it as well, that it's just an aversion to touch or to penetration, accompanied by this severe spasm with pain.
And I want to, because some of my clients who may watch this in the future come to me with so little education, I want to remind everybody this is Vulvina von Trapp. This is the vulva. So you, as she said, you may be able to tolerate touch anywhere here externally on your vulva. Your vaginal canal is what is the actual like penetrative portion. So even if you can tolerate touch out here, maybe even up on your clit, um, the actual penetration to your vaginal canal, this is not your vagina. This is your vulva. There is a difference. So just, we're here for education.
And I've even heard women tell me that like they can actually tolerate touch around the vulva, but when it comes to partner touch, they're so anxious that he's going to accidentally slip or go further than they were prepared for, that then they also develop an aversion to sexual touch in general because of the anxiety that it might go too far or to the place that's not comfortable for them.
What my another pelvic floor PT that I know, her Insta is Pain-Free Intimacy. She has this amazing like flow chart of how the anxiety around the touch then reinforces the vaginismus cycle, where you are anticipating pain, so then you brace for pain. So now your body and brain are like signaling that there's a reason to be upset and anxious, and that like reinforces, and it's a whole thing. And I will put the graphic up here in post editing so you guys can see that cycle. But it is so, yeah, like the anxiety around it can be so much.
100%. It's a snowball effect. It's like pain spasm, pain, anxiety spasm, pain, anxiety spasm, and it just amps and amps and amps. And so it's not just a matter of being like, oh, just relax. Oh, just have a glass of wine. Oh, you're a little uptight, but once you're married and comfortable, you'll get over it. It's not that at all. It's like a very like neurologically hardwired like reflex that ends up perpetuating itself.
So what are some things now, obviously, like if somebody is having pain when they try to use a tampon or engage in penetrative activities, that's obviously going to be like a big clue that, oh, I should probably get like investigated for this. But what are some other things that maybe they're like, well, I don't have pain, but maybe there's these other symptoms that it could be.
Yeah, so if you've never experienced penetration or tried to experience penetration, but you're having symptoms and now you're wondering, maybe might I have this problem? Things that you want to look out for would be a history of pain or trauma, and that could be sexual trauma. That could also be a really bad series of yeast infections, that really highly sensitize the nerves in that area. Women who run tense in the pelvic floor tend to have other symptoms potentially around pee and poo. So they might be experiencing urinary urgency or frequency, or a sensation of always needing to go. There might be pain with bowel movements, or like a feeling of being constipated or not being able to go all the way. But I will say that there is a difference between being what we often hear as like high tone or tight pelvic floor and having vaginismus. They oftentimes go together, but not always. And there may be women who are tense in their pelvic floor and having all these symptoms, but they don't have that reflexive, sudden, like clamping down response to vaginismus. And vice versa, there may be women walking around with relatively normal tone in their pelvic floor. So they might not have some of these other symptoms associated with tense pelvic floors, but the reflexive response is there when it comes to penetration. And I would also like to note, there's like this misconception that vaginismus is from like the beginning and forever, but there are many women who can tolerate penetration, whether it's tampons, gynecologic exams, or sexual penetration, and then have a trauma, whether it's an infection, whether it's pain, whether it's menopause. And now the skin is more delicate and is tearing a little bit, so it's associated with pain. And then they end up developing vaginismus after a period of being able to tolerate penetrative sex. So just because you could in the past and now that's changing doesn't mean you can say, oh, well, there's no way I could have vaginismus because I've had sex before. That is something that can develop over time in response to trauma, whether that's medical trauma, chemical trauma, physical trauma, like any type of pain or anxiety around penetration can lead to the development of vaginismus at any age and any stage.
You answered the question I was going to ask, because I was going to ask, tell us about secondary vaginismus,
Mhm.
because another creator friend I know had developed secondary vaginismus after her wedding. She was fine for a while, and then it was brought on, I think, by a yeast infection. And we know that the yeast infections can be common for girls who are going on their honeymoon for the first time, having sex for the first time, because they don't have proper education about sex and how to take care of yourself after you've had sex, and they wind up with that honeymoon infection, and now they can wind up having secondary vaginismus because of the infection. So it's a whole it's hard. It's
And,
hard.
and I think we have to remember it is a medical diagnosis. I think
Yes,
there's this conception that if I have vaginismus, it's because it's all in my head and something I'm doing in my head is making my muscles clamp shut. And there certainly is an emotional component. There certainly is like this cognitive behavioral like cycles that people get into, and the pain spasm anxiety cycle can augment itself, but it's a medical diagnosis. So the first thing that needs to happen if someone is experiencing difficulty with tampon use, difficulty with penetrative sex, difficulty with a gynecologic, hopefully the gynecologist is noticing this because you're right there with them, but like that, you need to rule out infections. You need to rule out, let's say, a rigid or imperforate hymen, right? Like we need to rule out some of these medical issues. I mean, there could be a bifurcate vaginal canal. Like there's all kinds of stuff anatomically that could lead to pain. And we don't want to just assume this is something she needs to like psych herself through, or just go get some dilators and that'll make it better. Or if I just talk to the right sex therapist, I'll be able to get past this. Like we need a legitimate medical exam and diagnosis as well.
for sure. And you just reminded me of the other thing is sometimes when I talk about the purity culture girl who winds up with vaginismus, or, gets married and realizes she has vaginismus because she hasn't attempted to have sex before the wedding because purity culture, and she chose to wait, and, all of those things, then winds up with vaginismus due to the purity culture trauma. I get a lot of men, because always it's the men, who are saying that you can't you can't get vaginismus from trauma, from purity culture, that's not a real thing. And Can you can you explain just like real quick how even like psychological trauma like purity culture can lead to vaginismus?
Absolutely. Okay, so I'll just say first, I'm not a psychologist, I'm not a sex therapist. I work with the muscles and the bones and the nerves and the neurologic connections. And the central nervous system, your brain and your nerves, are what cause every little movement in your body. Whether it's something you're aware of, like I'm thirsty, so I'm going to reach out and pick up my mug. That's my brain telling my nerves for those muscles to do that thing. Whether it's the doctor comes and knocks my knee with the reflex hammer and my knee reflexively kicks, right? That's a reflex within the nervous system. Imagine, this is one of my favorite ones. Imagine someone is like, every time they walk past you, they wail you in the arm. Like they just, and it hurts and they're hitting you, right? Eventually, when you saw that person coming, you would do this, right? You would clench up a little bit. And eventually, if they were coming around you enough and you felt this threat to your system enough, you'd probably walk around like this quite a bit. And you might be saying, ah, why is my neck tight? Ah, this shoulder feels stiff. And it's because your body is instinctively guarding against a real or perceived threat. And so I can't speak from personal experience of purity culture, but girl, you can. And you have explained to me that one of the things around purity culture is creating like this fear-based control system where virginity is the most prized thing. Virginity good, sex bad, sexy thoughts bad, sexy touch bad, everything sexy bad. Well, that's sexy. I mean, that's anatomy, right? Like those are muscles and connective tissue and like just a part of your body, like your ear or your nose or your mouth. But if we start to develop negative associations with touch, with engagement of that part of our body, it's going to reflexively contract and jump away. And eventually we're going to have sort of a fear-based response, a trauma response, if you will, because of messaging that we've gotten that our central nervous system has processed to interpret as sex is bad, sex is dangerous, touch the vulva is scary, touch the vulva is shameful. We process those things and internalize it. And this might be a tangent. Feel free to cut this out when you do your editing, but like I kind of get on my soapbox about this. We think about the mind and the body as these two separate things. Oh, you've got the mind-body connection. You've got mind over matter. And when we use words like this, we describe them as if they're separate. But all of the thoughts that occur in our system, all of the firing that happens in our mind, our brain, those are neurotransmitters. Those are chemicals bouncing around in our brain and creating the response of thought or feeling. But you have receptors for those neurotransmitters through your whole body. That's why when you feel stressed, you get indigestion. That's why when you feel anxious, you get butterflies in your stomach. It's a physical response to a thought or feeling, but no one's saying you don't really have indigestion.
But that's also why some women can experience mental orgasms.
Yes,
Exactly. Like that is
absolutely.
exactly why. It's not just like pain or trauma related. That is exactly why there are some women who can orgasm with a complete lack of physical stimulation. It's a mental orgasm. It is a full-on physical orgasm with zero touch whatsoever. And it's the
The
same
whole
thing.
the whole system is wired together. So when we have a feeling, that feeling processes in our head as a thought or a feeling, it processes in your body in its own way, whether it's an increase in heart rate, whether that's a mental orgasm, whether that's diarrhea because you're stressed or constipation because you're traveling. Like all of these things create physical responses and they come from mind, they come from thought, they come from feeling. So how can we tell a woman that this incredible indoctrination of purity culture that she may receive couldn't have a physical response in her body? I mean, the man that's saying that, I promise, goes home to his wife and says, well, I have high blood pressure because my job is stressful. Okay, what's the difference? There's no difference. It's just a different system in the body.
I'm not gonna lie. I asked the question because I was hoping to like find key phrases that I can use in the future for those men. And that's the one. That's the one that's like, yeah, that's it. That's it. Okay. How do we treat it? I have a complete lack of boundaries and time management skills.
Ah,
I'm already run over my goal for this episode, but I don't want to leave without talking about how do we treat this? How
nutshell.
difficult. I run into a lot of people who are concerned about like how difficult it would be to treat this because they're afraid of like it's such a fear-based thing to begin with. They're afraid the treatment's going to be worse than, what they're already experiencing.
We might need a second episode, but I'm going to give you in a
Yeah.
nutshell how I find the best results with my patients. There's
Yes.
as many ways to treat a person as there are people under the sun. There's as many ways to address an issue as there are different individuals, but I find that the best results in my practice come when there's a combination of three things for these women. One is skilled physical therapy in conjunction with when they're ready for it, not immediately. Don't freak out and go buy it for yourself right now. Dilator use. So skilled physical therapy with a physical therapist that incorporates dilator use at home for
And
deep.
I want
Yes,
to real quick, I'm going to note that I'm putting up a picture of dilators right here. They usually, from my understanding, you usually get like a graduated set of them.
yes.
And so I'm going to put a picture up right here so you can see that they are not scary and they're not like full detailed dildos, right? They are
Very
very
clinical.
clearly medical devices.
They are medical devices. They are not dildos. Two separate things. And I have a bunch of videos on my YouTube about how to use them if you want to check that out. But and I know we're over time, but I'm just going to say these are not for stretching. These are not for stretching. These are for desensitizing. And there's a huge difference. Huge
Difference.
difference. But anyway, so the three things would be physical therapy, incorporating dilator use at home, medical management, which may just be a simple medical clearing. It may be as in-depth as getting a medicated suppository to help the muscles relax, to get a topical cream, to numb the external area and make it easier for you to access for treatment. There's plenty of ways to make that journey with physical therapy much easier. But
I
even at
think
the very least, just a medical clearance.
Yeah, and I think it's important to note here that like if you are doing these things and you're like, "Oh, well these sound like things I could do on my own at home." Please don't, because someone's husband somewhere just had the idea of, "Well, we can just buy like they make numbing spray for men. We can just use that for you."
I
Don't do
can't,
that. Like
I
you're
can't
just
tell
going to
you
make
the
it
things
worse.
that I've heard. Please
Like
go to a doctor.
you're just
That's what they're there for.
don't use numbing cream and dilators and think that you can treat this on your own at home. You are going to potentially make it worse.
You
Like,
may re-traumatize.
yeah. So these are things that should be done with the supervision of a pelvic floor physical therapist and not just because you think that you can handle it because we went over how it would be treated professionally. So
Yes, thank you for saying that. This is assuming that you take my full advice of starting with a medical
yeah,
professional. There are tools that can be used to help you do the therapeutic process with more ease and less discomfort. And then third, either trauma therapy or sex therapy or some combination of both, depending on where you are in your journey. Even if you don't have a history of sexual trauma, maybe that's just not your history. This vaginismus has probably created some sexual trauma for you at this point, and there's a lot of baggage that goes along with having a chronic condition that interferes with your intimacy with your partner. There's a lot to unpack there, and I find that women have the best results when they're working with their MD, their psychotherapist, counselor, trauma-informed therapist, whatever it is, and physical therapy. Those three get the best results the fastest.
awesome. All right. Thank you so much for covering this for us. Do you have anything that you want to add as a final non-regarding time, my boundaries suck thought?
Uh, yeah, I just want to say that I think the first step is the hardest. And from what I see in my practice, just making the call, just setting up the appointment, and then showing up for your first physical therapy exam is the scariest and it's the hardest. And if you can do that for yourself, because nobody can do it for you, but if you can get yourself to that point, I promise it gets easier because starting is the scariest, hardest part. And this is absolutely treatable. There are 100% resources and community, and you are not alone in having to deal with this. it is treatable if you want it to be treated.
And I think it's important to note that showing up to the medical appointment, like, I have a lot of medical trauma myself. So I can only imagine like having to show up for something where you're extra vulnerable. It's okay to set boundaries with your provider and to walk in and the first thing that you say is, I have a lot of trauma. I have a lot of medical trauma. I have a lot of sexual trauma. I need you to go slow with me. I need you to respect my boundaries. I need you to ask before touching me. Whatever your boundary is, it's okay to lay that out respectfully to your provider. And if they don't respect your boundaries, get up and walk out. Like,
Find a new one. 100%.
100%.
Don't
Never,
re-traumatize yourself.
don't re-traumatize yourself. Never, you are paying them for services. They are not in charge of you. They are not in charge of your body. And if they are not willing to respect your boundaries on this most like vulnerable of topics, they don't deserve your money. There are providers out there who will 100% respect your boundaries and help you figure out boundaries that you may not have known that you needed or wanted, like asking for permission to touch you before touching you or something like that. So I want to put that out there as someone who has experienced medical trauma and continues to fight to, convince myself whether I actually need to see a doctor or not for a thing, because do I want to fight them?
Yeah.
So I have so much compassion for my girls that are dealing with this, who have to make that decision as well. So thank you so much, Dr. Leslie, for being here. I'm going to link your website and your podcast and the podcast episode that I did with you in the notes for this. If you guys have questions, I'm sure that you can reach out to Dr. Leslie. Do you see virtual patients or you just do in person?
We do, and vaginismus is one of the diagnoses that we can effectively treat in that way. Not every pelvic health concern you can treat without an actual office visit, but fortunately vaginismus is one that we do really well with.
Awesome. So if you need her information, it will be in the notes, and go have good sex.